Hi, this is Dr. Hizon, here to talk about injuries to the elbow and documenting those. As a general disclaimer, please refer to your particular doctor, as this is a general course not intended to be medical treatment, and your particular situation may vary. So symptoms with the elbow are quite common. It could be pain with lifting activities, exercise, or trauma. You may hear popping or grinding. It can be painful with flexion or extension. And you may have these different kinds of tests, especially the Hizon sign is where if there's an extension of the wrist where you pull it backwards and there's pain right on the elbow, that's a Hizon sign. There's a golfer's test, Mills test, passive tennis elbow test, pinch test, Tunnell's test, and stress type testing of the varus and valgus of the elbow. All these are important for you to learn those names. There's a history and physical exam, x-rays. Sometimes we'll do musculoskeletal ultrasound exams as well as other imaging like an MRI. The treatment typically starts with avoiding activities that irritate, using anti-inflammatories, medication, some home exercises, but maybe formal physical therapy, and sometimes we'll use some ice. Sometimes there's injections, different kinds like cortisone, some of the biologicals, which is called platelet-rich plasma, or even some others. There's some surgeries that could be done, as well as even some open surgery procedures. Sometimes we start off with just teaching the patient not to do things that aggravate it. You can use ice, and sometimes we'll elevate it. Some other pain relief techniques, there'll be some stretching and some strengthening exercises. So on documenting, you want to document that there's pain in which elbow, left or right, and for how long, how many days. And this is a such and such year-old male or female, and you can also say that they might have other medical problems like heart attacks or strokes or other medical things. Presents today for pain in the which side, which elbow, and for how many days. Be sure it's the patient's elbow side. Check the date that they started. Was it sudden or gradual? Where exactly is the pain? Is it on the medial side or the lateral side of the elbow? And then severity of pain is important to document both at rest and with activity at the minimum. You also want to know, is it constant or intermittent? Is the quality sharp or dull? Provocation, what makes it worse? And alleviation, what makes it better? Are there any other symptoms? So you can go through the template to check off and see if they've had any of these problems. This should be elbow pain. As well as what else have they done so far? Have they done rest or injections or medications or formal physical therapy? Have they have imaging, x-rays, a magnetic resonance or MRI? Have they had an ultrasound? And have they seen a specialist, orthopedic surgeon, a chiropractor, massage therapist, acupuncturist? And then we'll look at general family, medical, family social history. Do they use tobacco, exercise, nutrition, sleep? Have they gained or lost any weight since the last time they saw them? And then go through your usual review of systems. Generally, we describe how the patient is. Are they alert and oriented, male or female, and mild, moderate, severe distress? So you have to decide on that from the provider. And then do they have a general appearance, anything special? And then you go through the cardiovascular, pulmonary, abdominal exam. A lot of times we'll look at the joint above and below. So you'll look at, if it's the elbow, you'll look at both the shoulder and the wrist. And then you'll look at the affected elbow versus the unaffected side. And these are your typical things you're going to be looking for. Do they have any deformity, swelling, poor alignment? Do they have bruising, which is ecchymosis? On palpation, how painful are they? Where are they painful? Do they have range of motion changed with active range of motion, or passive range of motion, or resisted range of motion? And then which specific joint is involved? How are their reflexes? And then special tests. So in the assessment, you need to decide, is this a simple or complicated case? And does it require straightforward or complex decision making? And this is something where the provider can then tell you what the rationale and the reason for their treatment. In terms of the diagnosis, usually it's an M code. Pain in the right elbow is an M25.521. The left one is 0.522. And then you can have lateral epicondylitis of the right elbow or the left elbow. And these are just examples of other elbow ones that they should document. Now, with orthopedic injuries, besides the actual injury, you may want to, and you should, usually put down what is their activity, and so it's a Y code. So say they injured their elbow playing basketball, that would be a Y93.67, and then the place of occurrence. So all orthopedic injuries need a place of activity, activity, and then a place of occurrence. The plan for typical elbow type problems is some home exercise versus formal exercises and inflammatory medicines. May get some imaging studies. They might do an injection. They might do surgery. So pearls and pitfalls. Be sure to get the correct affected side, left versus right, of the patient. Be sure to document all previous treatments and also the medical history of elbow surgeries. Have they had any previous sprains or strains? Learn the various physical exam tests such as the Hizon, Golfers, Mills, passive elbow tests, etc. And please ask your doctor or provider if you have any questions about the examination and documentation of the elbow. And in a primary care, always ask about quality measures such as preventative measures. Takeaway point is that elbows are very, very common, especially if you're doing golfing or tennis. Usually there's a traumatic mechanism, meaning there was usually a specific event, but it could be gradual. Study hard to learn the various, these should be elbow tests that are common for the for shortcuts such as the Hizon and the Golfers type elbow test. And in summary, again, we thank you because while doctors save lives, medical informatics specialists and scribes will help save doctors. Thank you.